Dr. Steve Liebing. I'm a family medicine doctor here in Gatesville. The way that I arrived at Gatesville to practice medicine is kind of a long story. I'm originally from southeastern Washington. There I grew up on a hay farm. So for my formative years were all spent in the rural communities, working, doing custom baling and harvesting and things like that. And so I grew up in that community. I always envisioned myself working in that sort of environment because those were the people who I understood, and I understood the struggles they were. And I always wanted to do something that would let me give back to a community like that and be able to help those people. So when I went into medicine, that was what I was envisioned, the kind of environment that I would go back to work in. And I was completing my training in Waco and was looking for a program that would keep me somewhat in the area, or a place that I could work that would keep me in the area, but also be able to put me back in that sort of environment and take care of those kind of patients. And one of the first experiences I've had was actually being taken care of by another Coryell doctor, who was Dr. Beduniak, a surgeon, who actually was under his care for a short time for my own medical needs. I was very impressed by the quality of care that he provided and how highly he spoke about Coryell. That was my first introduction to it, and I started talking with the organization here, and I was very impressed by the patient-centered approach that they had, that I could tell very quickly when I interviewed with them that they had a deep care for the community and the welfare of the community. I also was very impressed by how well organized and ran Coryell is compared to many organizations just across the country. It's very difficult to operate a community health center in a rural setting because there's significant financial challenges that come with that. And Coryell was really impressive to me that they're so well organized and ran that. Not only, despite the challenges that are faced in a rural setting, we're actually expanding to meet the needs of the community that's here. So I wanted to be a part of something where we were proactive in moving forward and facing the challenges that the community needed, and really working hard to meet those needs and help our community to improve. Because I've felt those experiences personally in my life, I feel a greater empathy, I think, for the patients here, and I'm happy that I was able to come be a part of that. I think that one of the benefits that patients get by choosing Coryell is you have a community health system that is based in the community. We have specialists, we have services that are available that are here in the community. Patients don't have to travel a significant distance to come get help. And I think having that here is really helpful because you're getting you're getting physicians and services of people who are actually in that community and understand what the unique challenges of that community are. Coryell has been very passionate about expanding care to patients in this community and has positioned themselves in a way that they can do that. They're built for longevity. They're built to be able to sustain and continue on despite the challenges that might come along the way. I think that's the benefit of this. Is an organization that has proved itself over a long period of time that it's going to continue to be here to support patients. And we're not diminishing, we're not decreasing the amount of services that we offer, we're actually expanding. And I think that's a tremendous resource and perfect thing that's available for the community here. So starting practice off in a COVID-19 world definitely has its unique challenges. I think my onboarding process and starting a new practice here was definitely different. I didn't have the chance to go out and to immerse myself in the community and go to organizations, introduce myself, go to churches and things like that, which would help people understand that I'm a new physician in town. I'm here to serve the community, and that's what I want to do. I'm looking forward to that. So that's definitely had its challenges, and I wish that weren't the case. Another aspect of it is that people are scared. Whether it's a part of a visit that, if that's generally a part of the visit that with my patients or not, it's usually brought up, and people want to know what my opinions are on the matter, and I think that people in general are feeling a great deal of fear due to the circumstances, and they're seeing what's on the news, and I understand that, and I'm empathetic towards that. And I think that part of that challenge is being able to offer some comforting words to patients about things that they can do to strengthen their own immune system, help themselves to have a better immune system, or be as healthy as they can be, so that they can help protect themselves from that standpoint, but also offer some words, some comfort, because there's a great deal of fear about the unknown of the future, and that's definitely challenging because obviously none of us know the future. But I try to encourage them to protect themselves and to get our health in order. We need to make sure that we're doing things that are going to keep us healthy and to enable us to be able to weather the storms that come forward. But I always want to encourage my patients that things are going to get better. I think that when we focus on that and do the things that we need to do to keep ourselves healthy and keep our community healthy, I think we'll all be better off. So what is it like being a doctor at this time, behind the scenes, and how the organization's run? Being a doctor is a tremendous responsibility and privilege. And I'm just honored every day to be able to come to work and have patients who want me to take care of them. So it's a tremendous honor, and I feel that great deal of responsibility for my patients. One thing that's impressed me about the organization, as I've seen the kind of inner workings, is how hard everyone works every day to meet the new challenges that come up, whether it's an influx of patients who are concerned that they might have coronavirus or whatever those challenges might be. The organization is constantly in communication, constantly talking amongst themselves, trying to see ways that we can meet the needs of the patients. And so that's been very impressive, is that there's constant dialogue going throughout the clinic and throughout the hospital system. Everyone's always asking the question, what can we do to better meet the needs of our patients? And so that's one thing that is great to see behind the scenes, that every time a patient is coming in and talking with us, if they're bringing up a problem or a concern that maybe we don't have a great answer for right at the moment, everyone quickly moves towards trying to find a way to resolve that issue or to get the patient the help that they need. So whatever the demands are, whatever the concerns might be, I can see that how the organization is really trying hard to adapt in real time to meet the needs of the community. My interest as a family physician was really to be able to take care of the whole family. There wasn't any particular area that I didn't want to address. Whatever the concerns of my patients were, I wanted those to be my concerns and something that I could help with. And so I always try to do that to the very best of my ability. Some of those areas that I have a passion for I would say would be not only the rural underserved, but also behavioral health. I know that behavioral and mental health is a significant issue that affects so many different families, and often it's a challenge in not knowing how to address those issues, how to provide the very best care. I certainly don't have all the answers, but it's one of those areas that I try very hard to always be cognizant of, that's something that affects everyone's health and is not to be ignored. I understand that communities across this country are very underserved in people who feel confident with their ability to treat those conditions, and that's one thing that I take a passion in, and I look forward to taking care of those patients, because I understand how much it affects their life, and I want them to feel better. I want them to be able to have a full life and to enjoy the life that they want to live. But besides that, I like to see all patients. I love seeing newborn babies. I love seeing elderly patients. So whether it's the children to the grandparents, I like to see everybody. There's nothing that I don't like to see. I'm just happy to see patients because I want to take care of them. I'm Dr. Steve Liebing, family medicine physician here in Gatesville. If you have any family medicine or primary care needs, please come and see me. I'm happy to take care of any and all patients, and I want to do what I can to help you and your family.